H1N1 virus or the swine flu?
Well, as far as my understanding is that some people say that it is because of cohabiting with the swines itself, and others say that it's a similar type of virus that is found in the swine but has become airborne.
It is a virus that can travel between people and animals and between people and people.
I believe the swine flu is something you contract from pigs.
This particular strain of swine flu is actually a combination of swine, avian, and human influenza strains. The symptoms of this particular influenza are very similar to typical influenza A outbreaks. Fever, cough, runny nose, myalgia or aching in the muscles. This is not the first time that we have experienced swine flu. In 1976 there was an outbreak of swine flu, and fears of pandemic eruption at that time. As a result, there was a mass vaccination program for swine flu, and the pandemic never materialized. Unfortunately, as a result of the vaccination, there was significant degree of morbidity or illness and mortality. The deaths reported from that vaccination program were 20 to 30 deaths, and there was significant symptomatology, including a 7-fold increase in Guillain-Barré syndrome, which is a paralytic viral disease.
What are some of your fears around this particular virus?
Well, I guess the biggest fear would be that God forbid that I contracted.
I personally don't have any fears other than maybe for my grandchildren, but for myself at my age and my health status, I'm not too worried.
To date, there has been a total of 67 deaths related to the H1N1 virus in Canada. In most cases, these people already had a compromised immune system. The regular influenza results in 20,000 hospitalizations and 4,000 deaths each year. In Australia, where they have already experienced their winter season, the federal health minister is reassuring parents that the swine flu is no more dangerous than the regular influenza. Most people, including children, recover quickly with only mild symptoms and no medical intervention.
What measures do you plan on taking to protecting yourself and your family this winter from this particular virus?
I've found I've been a little more conscious of washing my hands and of how I sneeze, actually.
I personally think the best way to avoid such a thing is to be careful with what you eat and to keep yourself properly within the hygiene protocols.
The reason why I won't use the vaccine is because of its toxins, and it's not proven to be effective.
The most effective way to prevent influenza infection is to wash your hands. Wash your hands for 20 seconds with water and soap after coughing, after using the bathroom, after blowing your nose, and before preparing food and eating. Alcohol-based hand gel is an effective alternative when soap and water are not available. Cover your mouth with your sleeve or tissue when coughing or sneezing, and live healthy, eat nutritious foods, get enough sleep, and do regular physical activity.
If my family were to contract swine flu, I plan to treat them using homeopathic medicines.
We see hundreds of people every year in our homeopathic clinic who complain of symptoms of influenza. And we continue to find that homeopathic medicine helps them whether they have gastrointestinal symptoms or respiratory symptoms related to the flu. Homeopathic medicine has a long history of successfully treating viral disease. In fact, in its early days, it became world famous very early because it was successful in epidemics such as cholera and typhus and scarlet fever. In the 1918 Spanish flu epidemic, we saw a 98% success rate in homeopathic medicine with this particular influenza.